The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hey everyone, welcome back to another episode of APIC's The 5-Second Rule. Today we are going to be talking to our infection preventionists. Hey, you're not alone. This is all about the infection preventionist experience during the global COVID-19 pandemic. Crazy days for everybody, especially if you're in healthcare, if you're on the front lines, and certainly for our over 16,000 members who are infection preventionists across the entire healthcare continuum, acute care hospitals, all the way to your friendly doctor's office. So today we've got two great guests who are going to share their experiences, talk to us about how their colleagues are managing mental health. I don't know about you all, but I know this has been tough on me, tough on my family, tough on my friends, no matter what you do in life. So even if you're not an infection preventionist, keep listening because I think a lot of what we're going to talk about today will resonate with you. So with that, let me just dive right in and say that we have two great folks, two rock stars. We have Rebecca Alvino all the way from California. So she's one of our West Coast infection preventionists. She is at the University of California, San Francisco Health, and she specializes in perioperative and procedural infection prevention. She originally began her career in public health during the years of the West Nile virus in upstate New York. So that's a whole other outbreak that maybe we'll do another episode on. But she's also an infection prevention advisor for the California Central Service Association. She's an active member of APIC, and she serves for the board of the San Francisco Bay Area chapter and is currently the member of APIC's annual conference committee and the APIC COVID-19 task force. Hey, Rebecca.
Hi, Silvia. Thanks for letting me join you today.
So psyched you're with us from the West Coast. You are joined by fellow colleague Barbara Smith. Barbara A. Smith is a nurse epidemiologist at the Mount Sinai Morningside and Mount Sinai West campuses in New York City. So we're sort of doing a bi-coastal thing today. She's an infection prevention consultant for Mount Sinai internationally, currently advising, and I hope I get this right, the Taikang Shanlin Drum Tower Hospital in Nanjing, China. Barbara recently served on the board of directors for APIC, and she's the member of APIC's COVID task force with Rebecca. And we convened that group to really address a lot of the major issues around COVID and infection prevention. So welcome, Barbara.
Thank you, Sylvia. It's my pleasure.
Hey, did I butcher the name of that hospital?
That was pretty good, actually.
That's exciting. And I'll want to hear, I think all of our listeners will want to hear a little bit more about your work with colleagues in China, where much of this, obviously, the pandemic hit. Okay, so we're here to talk about what's going on with infection preventionists, their experience during the pandemic, and talk a lot about mental health and some of the tough situations our members are in and healthcare workers. Couple of things, though. I mean, if any of you listening Google mental health and healthcare workers, you could spend hours reading. There's a lot of research on the impact that these outbreaks have on frontline workers. I know that a recent article, July 2020, from the International Journal of Emergency Medicine, cited that a number of healthcare workers are higher risk depending on the department they're working in, whether or not they have a family member diagnosed. Get this, if they feel they have inadequate hand hygiene. I know you ladies are going to talk a little bit more about that. Whether they have improper PPE use, as well as close contact with patients. So I found that that's pretty interesting that they indicated these are some of the risk factors for depression, anxiety among healthcare workers. Barbara, does that surprise you?
You know what I noticed while you were talking about that, about the hand hygiene. So I think that that's been pretty evident in other parts of nursing careers, and certainly in medical house staff having trouble coping with changes. And this, of course, has been the biggest change in anybody's healthcare career, whether you're a novice or a long-seasoned professional. That's interesting about the hand hygiene that you bring up, because it is something the individual, whether you work in a healthcare setting or you work outside of the healthcare setting, or even if you're just out home taking care of your loved ones, that is something people can control. And one of the things that I kept trying to focus on, people kept saying, how are you managing when we first started back in February, March, and April? And I kept trying to focus on those things that I could control. So if I could help with a staff member understanding how to use the PPE better, or if I could help a family member understand all the pictures that they were seeing from across the globe of people geared up in PPE, and why weren't we doing that as well? Why were we not using the bunny suits and the, other types of respirators? So for me, it was try to focus on the things that I could control within my practice and within my family.
So I think I'm not a psychiatrist or a psychologist, but I think we all know that to the extent we have control over our environment and our situation, the better we feel. So one of the things that we keep hearing in healthcare is, this notion of frontline workers just being swamped. Talk to us. Let's set the stage, first of all. Maybe we need to go back. And Rebecca, I'm gonna ask you, perhaps share sort of the fundamentals of what infection preventionists do for our listeners who are not IPs.
Sure. So the fundamentals of infection prevention in any healthcare setting really they revolve around not just what is happening at the bedside, but then they really take more of a bird's eye view around what's happening throughout your system or throughout your facility. And it's the hand hygiene and it's the PPE. But when you look at something like the CDC's hierarchy of controls model, those are really sort of the last ditch controls that we would implement. We would look more towards elimination and substitution or engineering controls as part of a comprehensive program. And I think that if this pandemic has really highlighted something that we've really struggled with as infection preventionists, going to not just our frontline workers, but also to our leadership, it's to help reinforce that all of these things really have to come together to make for an infection prevention program to be effective. It's very much hand hygiene and PPE, because you're right, those are the things that we can control. And we feel like when we have control, we have a bit more stability and grounding in what it is that we're doing. But for those things that we can't see, the, heating, ventilation, air conditioning, the policies and protocols, looking and digesting the things that are coming from Centers for Disease Control, from WHO, and from the litany of papers that are being published, it seems at a near constant rate. Those are things that often aren't seen at those other levels outside of infection prevention. And sometimes I think those can be a bit of a source of anxiety for others that are not in our world dealing with those hierarchy of controls.
Okay, so I mean, just to take a step back, we all know we're living through a global pandemic. We here at the 5-second rule try to make things evergreen, but let's just be honest. It's been 8 months of living with SARS-CoV-2, COVID-19. There were challenges with infection prevention and control before the pandemic. That's why we have our show. Infection prevention is everybody's business. We're here to educate. We're here to highlight the work of infection preventionists, which is really to stop the transmission of healthcare-associated infectious disease, whether it's talking about how you keep your hands clean, using personal protective equipment like masks, gloves, gowns, whether it's talking about how you clean materials and surfaces in a healthcare setting, how you manage air. All of that was problematic. Now you have a global pandemic. One of the biggest challenges that APIC and its members addressed very early on was personal protective equipment. Barbara, talk to us about the challenge there that you faced at Mount Sinai. And then Rebecca, I'm going to ask you out at University of California, San Francisco. So Barbara, PPE, that is a huge issue. Talk to us about that.
So for the audience that's not in healthcare, when we say PPE, we're referring to things like gloves, gowns, different types of masks or respirators, as well as goggles or some type of eye protection. And they run the gamut from the simplest to the most complicated. I think it's a twofold issue for us here in Mount Sinai Health System. The first was the availability of supplies, and the second was making sure people knew. I guess it's a threefold issue. The availability of the supplies. The second is making sure people knew how to wear them correctly. And the third then is monitoring compliance with it. So we were fortunate that we had a terrific supply team here. They worked literally around the clock. Did we have times when we didn't get the material, the exact type of personal protective respirator or N95 that we wanted? Yes, but we always had something. The problem for us as the infection preventionist was trying to ensure that the frontline worker felt comfortable and knew how to use it. So we did a couple of different strategies in terms of making sure people knew how to use it. Some of it was just-in-time training. Some of it was having a buddy that watched you get dressed and, more importantly, watched you get undressed so you didn't contaminate yourself. We did have a great repository, I'll call it, of where the information could be stored that anybody on any unit could click in and find. So when we had a change in a different type of mask or a different type of gown, you could click in and see, oh, yes, this was approved by the committee that it meets the standard. I think the other challenge was that people wanted to wear more PPE than was necessary. So one of the strategies that we had with that was to reassure people that what we were providing was giving protection. And once we actually started with the universal masking, that made people feel really, really more comfortable. I do recall one little incident that I remember when people wanted to started wearing all kinds of the OR caps and whatnot. And we were talking with the chief nursing officer and whether that was part of the personal protective equipment or not. So we made a distinction that it wasn't part of the personal protective equipment, but we certainly wanted to encourage people to feel safer. And if they felt that they needed to wear kind of an OR cap or one of those scrub things on their head, they could do that safely. We would encourage it.
So, Barbara, let me ask you, it sounds like at Mount Sinai with you and your team, and I don't know how many people work directly with you. What were some of the stressors? What were some of the frustrations you were hearing from your infection prevention colleagues? Because what we heard at the national office, among other things, was stress around supplies and helping frontline workers understand what they needed to be safe. Was that the same where you are?
Yes, and I think more of the difficulty came when there was a change in product, that people weren't sure that that product was as good as the last product. And that's when the repository of information was developed. It had pictures. It had, who to call if you didn't understand if this mask was acceptable or if this gown was acceptable. And that seemed to help. We would print it out periodically and bring it up to their units on rounds. Yes, I know it looks funny. It looks like a pink isolation gown, but it does meet the standard. So after a while, people understood that the supply chain was working really, really hard to get the supply. The one challenge that did come was that people were having trouble like stocking them, right? In the beginning, people were taking, we don't know who, but people were taking stuff home. So we had to have a little bit more of a control on the distribution part of it.
Yeah. I actually, early on, I'll never forget, I got into an Uber and the guy driving had a respirator. I said, "Where'd you get that?" He goes, "Oh, some nurse gave it to me." And I thought, oh God, they're out, Psst, hey lady, here's a respirator.
I know.
But yeah, so crazy times early on. Rebecca, what about you out in California? Would you say you as an infection preventionist and your colleagues out there, was the stress coming from PPE, or were there other issues that really created a tough working environment?
Yeah, I think the PPE played a pretty integral role into contributing to a lot of the stress, in part because we've been dealing with this out here since very early February. So we were getting mixed messages around how we should handle this. And at the time, community transmission was extremely low, right? I mean, it was 0 to low, but we still didn't know how to behave because we didn't have a lot of guidance. So we just pivoted to, here's a novel pathogen. What do we need? We need essentially everything. Well, the infection prevention everything is different from what people were seeing in the news cycle with the bunny suits and, sort of the Ebola type of PPE that we would expect to see. But this is not Ebola, right? This is not a bloodborne pathogen. This is not something that is really transmissible through a lot of contact. It's very respiratory transmissible. So the PPE in those very early days was like, just give me everything. And we had to let people know everything feels better, but you have to be able to function in everything, and to try to function wearing the quote unquote everything of PPE and trying to start an IV, trying to start a central line, trying to intubate, it can be very cumbersome. So it was a matter of trying to de-escalate people down when we didn't have a lot of information, incomplete information about what should we be functioning at and what does everything look like. Everything looks like an N95 or a PAPR or a CAPR gown, gloves, eye protection. And we were able to sort of funnel patients into certain clinical areas so that we could really try to ramp up experts on the fly at the bedside that could manage these patients and sort of put people at ease as they became more practiced with it, because we were getting more practice with it. But another source of angst for our frontline workers is for those patients that were transferred in from elsewhere. The receiving team would be wearing a seemingly smaller level of PPE or de-escalated level of PPE, maybe eye protection with a surgical mask. And then here comes the transport team wearing that quote unquote everything PPE. So now our receiving team is like, whoa, should we be wearing something different? Because we're getting discordance between how our patients are being transported into us, what jurisdictions are saying in terms of what the PPE should look like. There were just a lot of different venues for information to be coming from, and they just didn't always reconcile. And that was a big source. And sometimes it continues to be a big source of stress for us, dealing with these competing information streams about what's the point of truth.
So you mentioned something that I think is another big factor that I want to tackle just briefly, and that is information coming from different sources, guidance that changes literally hourly, daily for sure, hourly in the early days. And would you say that that was an additional contributing factor to the stress and anxiety of IPs? And if it was, is it still? Barbara, do you want to go first on that one?
Silvia, that's an excellent point. I know that the whole country was dealing with it as an uncertainty when it first arrived. And at some respects, we still are. We don't have everything nailed down perfectly. So the challenge for us as the infection preventionists were to keep people as up to date with what the current CDC, WHO, our local health department was recommending, and to try to reassure them that we weren't hiding anything from them, that we weren't doing it because if there was a lack of supplies, that we were doing it because the information changed. And we did get more accustomed, my hospital epi and I got more accustomed to saying, this is the information that we know as of March 23rd, and we want to share it with you. I think what really plays a role here is how much your frontline workers, your leadership, and the community in your neighborhood relies on you before an event like this happens, before a catastrophe like this happens. So if you don't have that built-in trust before this kind of a catastrophe, it's going to be way more difficult. And we did a debrief afterwards, as well as a rev up to when we reopened some of the clinics. And it was really heartening to hear from our emergency management group did that part of it, that people felt like our infection prevention team had given them the information they needed in an honest and forthcoming way. But it was very challenging, even just to keep up with what the new guidelines were from one day to the next.
Yeah, I can imagine. I serve as APIC's Director of Practice Guidance, and that's part of my job is to help keep up. And yeah, some days it's crazy. On top of all of that, so really the changing guidance, the PPE supplies, which are to date still a challenge. Rebecca, talk to me about the working conditions. Can you share, I don't know, how many hours are you working in your team on average during this pandemic?
So it's been challenging for sure. And, our leadership and infection prevention really took the brunt of the constant working hours very early on. And so with that, we have this inherent need to want to be involved and want to be there for our frontline staff. And our leadership has really been excellent throughout this entire pandemic in being available not just for our frontline staff, but for our clinicians, for our senior leadership, and really for other partners outside of UCSF, because we've just gotten a litany of requests for information from other facilities, from schools, from dental offices. It's the constant request for information about how to guide and navigate clinically through this pandemic. Our leadership and our colleagues have really taken this on because that's who we are by nature. But it has been taxing. It's been taxing for us. And we're fortunate in that our health system has not really laid off, furloughed, reduced hours for employees across the board. They made that commitment. But we do have hiring freezes going on, and our bandwidth is pretty low right now. So we have been fortunate to get sort of a dedicated bank of time across all the University of California that deals with COVID, right? If you're sick with COVID, if you have a family member with COVID you have to take care of, if you have to homeschool your child or you need to do other things that are impacted because of COVID, we've got a bank of time to use through the end of the year. And our leadership has been very vocal about us taking it and taking a break, taking a mental break, shutting off our phone, even though we say we want to be available if something comes up while we're on vacation. We are drawing the boundaries because we just need that break.
Yeah, we've heard this across different professions as well. People are burnt out, they're tired, they're working long hours, the mental health and strain, and yet wanting to also be part of the solution, be helpful, be supportive, be a team member. And you all are part of the community, right? You have family, friends, you live wherever you live. And so that really is important in terms of managing during the time of crisis, which leads me to, we shamelessly plug here at APIC 5-second rule. And there is a lot happening at the APIC National Office. You both are part of the COVID-19 task force. And so we are providing a number of different resources to the members to help. And among those great resources includes a wellness program coming up in October. So I'll plug this later on, but we at the national office, and no matter what you do, there's this need to sort of address how this is making us, frankly, crazy, how it's just really impacting people's wellness. Let me ask you this, ladies. Rebecca, I mean, if you think about everything that's gone on since, well, for you out in the West, February, okay? And here we are further on in the year. What's bugging you about the issues of mental health for infection preventionists and other healthcare workers?
Silvia, that's a really great question. I think that oftentimes when we think about the healthcare workers that are bearing the brunt, we often think about the frontline bedside clinician, whether it be nurses, the nursing assistants, the physicians, the technologists in pharmacy, radiology, and elsewhere that support the clinical day-to-day operations. And they absolutely have been bearing the brunt and been very accommodating to this constant change of state during this pandemic. But for us in infection prevention, I mean, for me personally, there has been some times where there has been some moral conflict that has come up when we get a recommendation where it just doesn't sit well with us, right? When we see things that are going on in the community, when we hear recommendations that are coming out, or we see these newspaper headlines that come through that our frontline staff or others are citing as a point of consideration, it starts to weigh heavily on you when you can't provide the equipment, the tools, and the resources that our frontline clinicians are used to doing or used to using, and we have to change recommendations constantly. It really does begin to weigh on you as an infection preventionist. To say that there's a little bit of guilt that emerges, I think is accurate on the infection prevention side. I don't really know how else to describe it aside from we're right there with our frontline clinicians in feeling the weight and the stress that this pandemic has brought about.
Wow. And you mentioned the term moral conflict. I mean, that can just beat down on you. And we really haven't tackled that. Barbara, what about you? What's bugging you about this issue of mental health and IPs? And
let me give you an example that happened early on. One of my someone in my department said, and she's a more novice IP, what's bothering? What are you most worried about happening with COVID? And to me, my feeling was, oh my gosh, if we lose a coworker. And of course, we know across the country there have been healthcare people who succumbed to COVID or had serious outcomes from it. But her response was she was afraid of giving out the wrong information. So I think that was part of, and I realized later on that's true. Like she was worried that she would lead somebody down the wrong way or give them information that could lead to some kind of bad event occurring for them or for the patients. So I guess the part that the stress that we would be feeling, that I would be feeling is I don't want to misguide somebody, or I don't want somebody feeling like we're lying to them because of other extenuating circumstances. I've kind of felt in the beginning when we were packed full of patients, I was sort of in a cocoon. It was work. My husband would not let me drive on public transportation. So I would go home, get driven to work, go back, and it just felt like a cocoon, and you almost didn't have time to breathe. And I'm glad Rebecca's saying the part about leadership is trying to make people realize they have to take some time. They have to disconnect from the immediacy of it and try to take it in the long term. But I think the good part about it is that, and we hate when this happens as infection preventionists, is that people recognize our value and our skills when there's an event like this or when there's an outbreak like this. But hopefully we will have this longer lingering impact. I think it's also been an opportunity for people outside of acute care hospitals to realize what infection preventionists can do. As Rebecca mentioned, there's been a lot of outreach to not just outpatient clinics, but novel areas like the nail salons, like what should we do? So, we do have a unique skill set, not just in terms of our knowledge, but I think in our way of interacting with people and encouraging people to do the best they can for themselves as well as their residents or their patients.
Well, I would say certainly on this show, we try to highlight all the great work that our members do. And it's not a completely dismal picture, because I think it has shined a light on the importance of just basic fundamental infection prevention and control, as well as, and I'm just going to say it, it's also exposed the need for greater education among healthcare workers to understand disease transmission, to understand, you're not going to get COVID necessarily by touching certain items. There's just been a lot of talk in the public and in healthcare circles around understanding disease transmission. And you know where I'm going with this. We're going to be doing a lot more episodes on that. Again, shameless plug, you know me. And we do have a great episode, folks, on outbreaks. And what you said, Barbara, is true. Most of the work of IPs goes unnoticed until there's an outbreak, an epidemic, or a pandemic. And here we are. So, but I mean, we don't want to paint a completely dismal picture. What are some of the fun, great things that both of you have noticed as a result of the work you're doing? I mean, what are some of the bright lights? Rebecca?
I will never forget in March when I just had a day finally where it felt like I got hit by a train. It was a Friday afternoon and it just finally all caught up with me. So I was driving home. I live in the East Bay of the San Francisco Bay Area, and I was driving home on the freeway. And as I am just wanting to get home, I see a sign up over the Fruitvale Ave exit on 580 East, and it's a huge sign that says, "Thank you, healthcare workers." And it was like in that moment, just a tear streamed down my face. And I just was like, oh, thank you. Like, our work is not going unnoticed, right? And so we have seen some of those very small signs, notes of thanks, notes of gratitude and appreciation for the work that we've done. People and partners that I've had within the health system that I don't really work with unless, there's a committee meeting or something like that. I've gotten emails, I've gotten notes and phone calls. Hey, Rebecca, thank you for your help on this, right? Whether it's writing guidance to help in the periop realm or something like that. And I got to tell you, shameless plug also, I've gotten a lot of thanks from a lot of like shoe companies, for example, like, hey, thank you for being a nurse. Here's $100 gift card for a pair of shoes. And I'm like, yes, thank you. Right. So there has been a lot of appreciation given to the healthcare worker. And I feel like as infection preventionists, we absolutely are a part of that pool and need to be comfortable with taking that recognition when we do receive it. I mean, yes, when it's not a pandemic, we sort of linger in the background. And now that there's a pandemic, our work is really coming to light. And when we get that appreciation, we have to be comfortable with receiving that.
Yeah, great point. So if you're listening out there, healthcare worker, IP, you're being acknowledged, and accept the thanks because you deserve it. Hey, Barbara, what about you? What are some bright spots you've noticed? What are some things that you think
I have a couple of things that I wanted to point out. One of them was one of the major airlines was doing a campaign if you entered a raffle as a healthcare provider, and they listed it as frontline workers. And I'm sorry I didn't keep it and send it in, Silvia, to APIC headquarters, because in addition to nurses, doctors, social workers, respiratory therapists, they actually listed infection preventionists. I was amazed that they included us. And then I won 2 round-trip tickets to anywhere in the United States. Unfortunately, I may not be able to use them because we're still under travel restriction. But that was nice that they not only thought of people as, the people that were at the bedside, but they were thinking of people behind the scenes that were supporting the people at the bedside. The other bright light that is, of course, getting the people home. We just had somebody transferred to our rehab center who had been here literally since, I think, the first week of April. But the last year, our hospital system did something called Better Together, and it was a whole campaign that just about every, I would say 80% of the employees attended. And when you do those things, you kind of think, oh, this is just paper, and we're just going to sit in the auditorium for a day and do these, role-playing activities. But in the midst of it, probably around the middle of April, the end of April, one of the housekeepers was talking to the nursing attendant in the intensive care unit, and I heard him say to her, you know what, this is what Better Together really was about. And he was right. I said, it's true. People went above and beyond, and just seeing coworkers going above and beyond and really helping to support themselves, to support each other, and to support the relatively few family members that we let in during the highlight of the highest census. So that was really heartwarming to see somebody putting it in action and making the connection about a program that, other people could have blown off.
Right. Sometimes those things become quite perfunctory.
Yep.
Yeah, I would say the same thing from the association perspective. We've come together with other entities to produce education. We've worked with the industrial hygienists. We're working with the ultrasound folks, emergency medicine. So even the association community and APIC has sort of rallied and come together. And those are the positives. And I think what I'm hearing you both say is that despite the stress, the anxiety, the pressure, what are we going to do about PPE? Oh my God, these guidelines are changing, every 10 minutes. There are bright spots. We are coming together. We know more than we did months and months ago. And so, you are getting acknowledged for the important work you do. So those are the bright spots. And I cannot thank you both enough for taking the time to share your story, to share your experiences, and all the work that you do on behalf of the frontline workers and the patients they care for. So Rebecca, thank you. Barbara, thank you for being part of today's episode. And as always, I want to remind everybody to check out our website, www.apic.org/COVID-19, where we have tons of great information, and where you're also going to find out if you're an IP out there. Coming up, we're going to have some wellness series, webinars, and other gatherings virtually to help you all sort of connect, share your story, feel better, get better, be better. So thanks again for joining us at the 5-Second Rule.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff, including Silvia Quevedo and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphin.